Thank you very much, Susan. And as already announced by Susan, so the next speaker will be Sven Borgos from SINTEF in Norway. And Sven will talk about, let's say, the technologies or the assays currently used at EUNCL and the next generation of assays and how we move from the current states to the future. Sven, the floor is yours.
Thank you. First of all, obviously 10 minutes is not enough to cover all the frontiers in nanomedicine. So do not be insulted if your favorite technique is not mentioned here. Nanomedicines pose quite a lot of parameters that can be characterized. And some of these are general, like endotoxin contamination. A lot of them are nanomedicine specific. Things like surface potential, surface functionalization, sizing, drug loading, since you have a controlled release mechanism. So obviously there is a lot to take onto here. The current cascade, the analytical cascade, is built very closely on what EUNCL has done. There are techniques that are standardized and validated. They are all based on standard operating procedures. It should also be mentioned that the assay cascade is not static. We are actively seeking to optimize and develop it. That's actually part of the project. The first stage is a pre-screening. That's kind of the gate to get into the characterization cascade. And that, for instance, would be where we pick up endotoxin contamination. You have to be endotoxin free in order to get access to the rest of the cascade. Next thing then would be to start the physicochemical characterization. I'm not going to go into detail because Jennifer has kind of described this already, but the physicochemical parameters, the in vitro parameters, and finally the in vivo. And not every product will go through all of these. It will be on based on necessity. If something turns out to be completely toxic in the in vitro situation, you would not want to start expensive animal experiments. The aim is to improve the preclinical characterization in order to bring nanomedicines into the clinic. The improvements then in the assay cascade could be on things like robustness. Assays should be robust. They should not be very dependent on the operator. It could be in terms of speed, getting things done more quickly. It could be in terms of cost, getting them done more cheaply. For instance, in vivo experiments are really, really expensive. It could be in terms of sensitivity. And it could also be in terms of completely novel endpoints, like parameters that you have actually not been able to see before. New technologies can actually bring you completely new ways of looking at the world. This means that in order to get a new technology into the characterization cascade, it is the applicability that is important. It should be useful. That means that it might not be the very, very cutting edge technology. It might not be the thing that was published last month because it's simply not mature enough. It's not robust enough. We need something that we can trust. And also, obviously, it's really, really important to consult the regulators. What are their needs, as Susan also mentioned here. Like, we don't want to develop a very fancy technology that is not really needed by the regulators. I should say 2 words about the satellite labs. Besides the core partners of the project, we have associated labs that can provide specialized competence where this is needed. Outside of the core assay cascade, there might sometimes be needs for specific characterization for specific materials, and that's where the satellite labs come in. Should also mention that the inventory of satellites is a dynamic thing, so you are welcome to see if you think you can contribute something new to this and contact us. If you feel that you have a technology that we haven't covered that will be really useful, please contact us. There should be details on the website about the current satellites. Just keep in mind that it's not enough that you have a fancy technique. It needs to help us to make safe nanomedicines. Scott already mentioned this one in his talk yesterday. Drug release is a nanomedicine-specific parameter. to a large extent anyway. And it's also a parameter that applies to a lot of the nanomedicines in development. The controlled release mechanism. You have at least 3 different forms of drug in a nanomedical system. You have the particle bound, you have the protein bound, and then you have the free drug. And only the free drug actually gives biological activity. And these are in equilibrium. They're not static. So you have a really complicated situation in terms of the active free drug. There are some existing methods available to do this. They generally have some issues, especially in terms of process-induced drug release. And just last year, the NCL published a very promising method using stable isotopes that are chemically equivalent, but still possible to separate by mass spec. Stable isotopes has been used in standard pharmaceutical analysis for quite some time. It has not been applied to nanomedicines before. And the important thing here is that you should add 2 stable isotopes. One that will equilibrate with the actual drug from the nanoparticle, and one that will function as an internal process control to make sure that you correct for losses during the extraction. It seems really promising. Also, one technology that we feel is very promising that has not been implemented yet is the use of physiology-based pharmacokinetic modeling. It's a mathematical description of the ADME parameters, which is you make a mathematical model and you populate it with measured data. And this is really powerful because once you have a good model, you can do pretty much anything you want and it will not cost you anything. There is no expensive animal experiments in here. You can really play around with the parameters. And there are some really promising results on this. So really excited about that. Then a couple of specific challenges. Surface functionalization is still difficult to measure, especially if you want to do the topography, the mapping of it as well. It's not only the degree, but also the distribution of functionalities. This is tricky. Hydrophobicity is another parameter that is very relevant and not necessarily so easy to measure. And then, of course, we get to the protein corona, and there will be a whole session on that later on today. Not only as a descriptive thing. I mean, protein corona is created really quickly after exposure to plasma. So something happens, and the pristine nanoparticle doesn't really exist anymore. But also to use the protein corona as a tool to actually actively get the nanoparticle to where you want it to be. Endotoxins was mentioned by Marina extensively yesterday. It's a really critical parameter to screen for, and as she said, it's not really improving. They're still getting 1/3 of the samples contaminated with endotoxin, and it hasn't changed. So obviously, this is really, really critical in order to not spend a lot of time and effort on things that will never go into the clinic anyway. And the current assays they are sensitive, but they are quite demanding to do right. Very briefly on some technology development. The field flow fractionation has kind of come up as a really powerful tool when it comes to separating heterogeneous population and analyzing heterogeneous populations of nanoparticles. There is another modality of FFF coming up, electrical separation based on the total charge. That's really interesting. There has been some use of thermal FFF on micellar formulations. And also there was a paper very recently on electrokinetic separation of a broad range of nanoparticles from plasma. So getting your nanoparticles intact out of complex media is of high interest. Single particle techniques seems to be something that is generally emerging. Single particle ICBMS has been around for a while. Single particle intact mass measurement of nanoparticles has been described. And the techniques of nanoparticle track analysis, the tunable pulse resistor sensing is also getting established. And just to remind you what the overall aim is at the end, it is to get more nanomedicines to the clinic in order to improve public health. So that is why we are doing this technology development. Thank you.